My name is Tim Collins. I'm CEO of the Irish Heart Foundation. I'd like to thank the EPA for inviting us to participate in this conference. For those of you who are unfamiliar with the Foundation, we are a community of people who fight to protect the cardiovascular health of everyone in Ireland. Our work breaks down into four main areas: campaigning and advocacy to change public policy, innovating and leading in health promotion and prevention campaigns and programs, CPR training, and caring for people in the community living with stroke and heart conditions. And under our new strategy, we have three main priorities: ensuring that we address health inequality in everything we do, embedding health literacy in all of our programs. We believe health literacy is a vital gateway to helping people to manage their own health and change their health behaviors, and then an ongoing commitment to innovation and research. Over the last 2 years, we've had a focus on air pollution and cardiovascular disease, campaigning as the Foundation, but also campaigning in partnership with the British Heart Foundation. And we're also a founding member of the Climate and Health Alliance, which is an organization of over 20 health organizations, including the Foundation, the Cancer Society, the College of Physicians, Surgeons and General Practitioners, and Irish Doctors for the Environment, to name some of them. And we have a number of priorities: addressing air pollution, campaigning to increase active travel, and sustainable food systems. And the Alliance isn't just focusing on the impact of climate change on health, which is obviously going to be serious, but also focusing on the impact of action on climate change on positive health, how it can actually drive health co-benefits in terms of better air quality, more physical activity, and better diets. So looking at heart disease and stroke, it's Europe's #1 cause of death. Almost 9,000 people die every year in Ireland. Over 2 million people are at risk of or living with the long-term impacts of heart disease and stroke. And lest you think this is a disease of older men, 1 in 4 people who have had a stroke are under the age of 65, and heart disease kills more women than breast, cervical, or ovarian cancer combined. And we've all known for quite some time that as adults, we're quite at risk. Over 2/3 of us are living with overweight or obesity. 1.5 million adults are living with high blood pressure, and most of us are not getting the recommended daily amount of physical activity. But children are increasingly at risk. 1/4 of our children live with overweight or obesity, and a subset of those are now living with high blood pressure for the first time. And still a large number of children are not getting the recommended daily amount of physical activity. So looking at the causes of cardiovascular disease, what can we change? Well, if you look at this graphic, what we can't change is the bit in the middle. That's our genetics, our age, our socioeconomic group, or ethnicity, but everything else can be changed. We can change health risks in terms of blood pressure, obesity, blood cholesterol, or diabetes. We can change our diet, increasing the amount of physical activity that we take, stopping smoking, drinking less. But we believe the biggest single influence on health are actually environmental factors: our built environment, access to health services, the relentless marketing of unhealthy foods, and air pollution. And looking at where air pollution ranks in these factors, surprisingly, it ranks 4th, behind high blood pressure, tobacco, and dietary risks. Globally, air pollution contributes to an average loss of a life expectancy of 20 months, almost as high as tobacco, and remains underappreciated by governments and by the health community as a modifiable risk factor. So looking at air pollution and health in Ireland, many people looking at this conference today or attending this conference may not remember the Ireland of the 1980s, when we were beset with toxic smog during many, many days during the winter, when we had a temperature inversion. During those days, I was practicing both as a junior doctor and then as a GP, and I can remember as a junior doctor being called in the middle of the night and walking out of the doctor's residence in the Meath Hospital and to the entrance of the main hospital 50 yards away, and not being able to see the entrance of the main hospital because the air was so thick with smog. I then worked in the Mater Hospital in a respiratory ward where every time there was a temperature inversion, the ward would fill up with elderly people suffering from COPD, and many of those people died. After that, I ended up working in RTE, making environment programs, and we made actually a documentary on smog. And then I went to work with Mary Harney, who was putting together the regulations which subsequently banned the sale and burning of bituminous coal in the 1990s. And that was 30 years ago. And those regulations and the impact of those regulations probably stand out as one of the most effective public health measures in recent decades. And they were taken in the face of huge political and vested interest resistance. And it was only really through the hard work of Mary Harney and the late Des O'Malley, and incidentally Charles Haughey, that those regulations were passed. And we estimate that up to 10,000 lives have been saved since then because of that. So our understanding of air pollution has evolved since then. Smog may be a thing of the past, but air pollution remains a significant health threat. And the focus has shifted from what we can see to those invisible killers, particulate matter, nitrogen dioxide, and ozone. And in 2018, the EEA published statistics indicating that almost 380,000 deaths in the EU were attributable to PM2.5 exposure, 54,000 deaths attributable to NO2 exposure, and 19,000 odd deaths attributable to ozone. And as you can see, the key pollutant is PM2.5. Of the 1,400 deaths per annum in Ireland, 1,300 are attributable to PM2.5s, and the cause of death predominantly heart disease and stroke, but also COPD, cancers, respiratory infection, impacting on children, pregnant women, the elderly, and those living with pre-existing heart conditions worst. And also then the mortality, unsurprisingly, highest in the most deprived areas where quality is worst. So how does air pollution impact on health? Well, it impacts on multiple organs, on the eyes, nose, and throat, on the respiratory system, on the central nervous system, on liver, spleen, blood, the reproductive system, but predominantly on the cardiovascular system. And we know from the last 18 months, there's now evidence that air pollution alters respiratory defense mechanisms, leading to more severe COVID infections. The evidence of association between air pollution and cardiovascular disease is very strong, and it's most consistent for particulate matter. And if we look at short-term effects, there's strong association globally between short-term variability in PM levels and cardiovascular disease deaths. And this isn't surprising because it's easy to actually associate cause and effect, in other words, with a spike in air pollution and then a spike in deaths. And there's lots of research, recent research published by Dr. Colin Byrne from the RCSI in 2020, analyzed daily hospitalization for all stroke with air pollution level monitoring data with a lag of 1 or 2 days from exposure, and found that short-term air pollution winter is associated with hospitalization for all stroke in large urban centers. Recent article in The Lancet associated short-term exposure to air pollution with increased risk of intracerebral hemorrhage. And interestingly, also again in The Lancet, looking at lockdown interventions that led to substantial reduction in PM2.5 concentrations in China and Europe, that estimated that tens of thousands of premature deaths from air pollution were avoided. The evidence of association in terms of long-term effects is more difficult, obviously, but again, the evidence is very, very strong. The ESCAPE project, which was published in the BMJ in 2014, followed 100,000 people over 11 years and found that long-term exposure to particulate air pollution is associated with an increase in coronary events, even at levels below European limits. And then a University of London study looked at long-term exposure to NO2, PM2.5 and PM10, and that was linked to an increase in the size of the left and right ventricles of the heart. And that affects the performance of the heart over time as a precursor to heart failure. And those exposure levels, again, were at or below WHO limits, so we're actually quite low. And we're not just talking then about ambient air pollution or outdoor air pollution. Interestingly, a study that was published last year, a combined study from TCD and the University of Lancaster, sampled 7,000 older people and examined concentrations of PM arising from burning peat, wood, or coal in open fires, and found that open fire usage negatively impacts on cognitive health. So it's easy to understand how particulates can cause lung damage, because when we inhale them, the larger particulates get caught in the upper reaches of our lungs and the microparticles get caught in the lower reaches. But how do we know these particles penetrate into our cardiovascular system and cause heart disease and stroke? Well, the British Heart Foundation set out to answer this question and published a study in 2017 where Miller and a group used gold nanoparticles to evaluate particle translocation. Healthy volunteers inhaled the particles. Gold was detected in blood and urine between 15 and 24 hours after exposure and was still detectable 3 months later. And the particles preferentially accumulated in inflammation-rich vascular lesions. So they concluded that translocation of inhaled nanoparticles into the systemic circulation and accumulation at sites of vascular inflammation provides a direct mechanism that can explain the link between environmental nanoparticles and cardiovascular disease. So what damage then do these particulates cause to the cardiovascular system? Well, as the University of London research indicates, oxidative stress or inflammation and translocation of the particles into the systemic circulation can cause myocardial remodeling. That is the changes to the structure of heart we talked about, those enlarged left and right ventricles and subsequent heart failure. It can also cause progression of atherosclerosis, which is a buildup of fatty materials inside the arteries, which can cause blockage and angina in the heart and heart attack. It can cause hypertension because of reduced blood vessel flexibility. Again, that's one of the highest risks for stroke and heart failure, and it can also cause thrombosis and life-threatening arrhythmias. So how far do we have to go to tackle particulate air pollution? Is there a safe level? Well, the short answer is no. An article in 2020 in the International Journal of Epidemiology investigated the relationship of ambient PM2.5 exposure with cardiovascular disease mortality in over 500,000 men and women aged between 50 and 71 years in the US. And it found that long-term exposure to fine particulate air pollution is associated with ischemic heart disease and stroke mortality, with excess risks occurring in the range of and below the present US long-term standard for ambient exposure to PM2.5, indicating the need for continuing improvements in air pollution abatement for CVD prevention. Now, we've obviously had continuous improvements since 1990. We've had a 60% reduction in PM2.5 levels in Ireland. But in 2019, PM2.5 WHO daily limits were exceeded at 25 out of 35 monitoring stations in Ireland. So quite plainly, we have some distance to go to improving the situation here in Ireland. And interestingly, those levels have very recently been decreased by the WHO. So they've published very recently new air quality guidelines, which literally halved the annual air quality guidelines for PM2.5 and substantially reduced the daily or 24-hour level. So back to air pollution and health in Ireland. We know there's 1,400 deaths from air pollution every year. 1,300 of these deaths linked to PM2.5, and these mainly come about through the combustion of fossil fuels. Most of those, about 55 or 56%, from burning peat, coal and wood in domestic settings, and then about 14% from travel or from transport, about 13% from industry. Most of these deaths are due to cardiovascular disease. Last year and in the beginning of this year, we did some research to assess the sense of public understanding of this issue. And we found, unsurprisingly, high levels of public concern about air pollution. But most people believe that transport and industry are the main sources, and not domestic burning of domestic solid fuel. Most people believe that the leading cause of death from air pollution is lung disease and lung cancer, not cardiovascular disease. And just 42% agree that burning peat, coal or wood in an open fire causes indoor air pollution, which is damaging to health. So that's quite worrying. So in conclusion, what do we need to do? Well, we need to publish, implement and police the solid fuel regulations, which have now been promised on foot of the public consultation, which was carried out at the beginning of this year. And we believe that there are solid grounds or good grounds to believe that if these regulations are published and implemented, that they will actually be quite effective in reducing the amount of very, very smoky solid fuel which is burned in homes around the country. We need to continue to expand air quality monitoring. We need to accelerate the retrofit of homes dependent on solid fuel for heating, and eventually phase out all solid fuel as a method of home heating. We believe we need a new Clean Air Act, and we need to adopt the new WHO air quality guidelines to implement or to underpin it. And it's probably, it's quite useful in that last week and this week, we've been looking at what's been happening at COP21 and our own, admittedly, quite ambitious climate action plan. And I think it's important that we get the public behind that climate action plan and neutralize the vested interests that are opposed to all the actions that we need to take if that's to be a success. I think one of the things that we can do to achieve that is to put health gains at the center of the climate action plan, to say to people, this isn't just about climate and the temperature of the air around us, but it's actually about immediate health benefits that are current and health benefits to future generations. And we believe that that could be actually a key driver of the climate action plan, which is really important if we're to reshape our society and our economy in future years. So thank you again for this opportunity to address the conference.